Respected audience, Assalamu alaikum. I am Professor Shamsudjaman, Professor of Pathology. I welcome all in today's 34th lecture on pathology. Today's topic is hyperemia and congestion. First come to hyperemia. Before going to discuss about hyperemia, we have to recapitulate. Suppose this is tissue. This is the arteriole. These are the capillaries within the tissue. And this is the venule. Blood enters into tissue through the arteriole. Then from the capillary, ultimately it is drained by the venule. This is arteriole. This is venule. Dear audience, if there is arteriolar dilatation, what will happen? There will be increased volume of blood within the tissue. This increased flow of blood in the tissue following arteriolar dilatation is known as hyperemia. So now come to definition of hyperemia. Increased flow of blood in affected tissue or in part of tissue is known as hyperemia. Again, increased flow of blood in an affected tissue or in part of tissue due to arteriolar dilatation is known as hyperemia. Again, increased flow of blood in affected tissue or in part of tissue due to arteriolar dilatation is known as hyperemia. Now come to mechanism of hyperemia. Arteriolar dilatation due to sympathetic neurogenic stimulation or due to action of vasoactive amines, due to action of vasoactive amines like histamine and serotonin. Arterial dilatation due to sympathetic neurogenic stimulation or due to action of vasoactive amines like histamine and serotonin. Following dilatation, increased flow of blood in capillary of tissue, and due to increased flow of blood in capillary of tissue become red. Tissue becomes red. And this is the mechanism of hyperemia. First, there will be arterial dilatation due to sympathetic neurogenic stimulation or due to action of vasoactive amines like histamine and serotonin on the arteriole. There will be dilatation and increased flow of blood in the capillaries in the tissue, and the tissue becomes red due to increased flow of blood. Now come to examples of hyperemia. One of the example is hyperemia in acute inflammation. Dear audience, you know, inflammation is the reaction of vascularized living tissue to local injury. Provided the injurious agent does not destroy the tissue, is known as inflammation. You know, in acute inflammation there is changes in blood flow and changes in caliber of the blood vessel. In acute inflammation, what happens? There is transient vasoconstriction, and this transient vasoconstriction is followed by vasodilatation, that is arteriolar dilatation. And due to this vasodilatation or arteriolar dilatation in acute inflammation, there is increased flow of blood in tissue at the site of acute inflammation. So, hyperemia occurs in acute inflammation. Another example, hyperemia in fever. Dear audience, you know, in fever, during the remission of temperature, what happens? There is increased flow of blood in the cutaneous blood vessels due to arteriolar dilatations. And due to increased flow of blood in the cutaneous blood vessels, there is radiation of temperature from the blood vessels in the atmosphere. Another example of hyperemia is hyperemia after exercise. Dear audience, you know, after exercise there is sweating, and before sweating there is redness of the skin, and it is due to cutaneous arterial dilatation, and it is due to increased flow of blood in the cutaneous blood vessel. So it is an example of hyperemia. Is hyperemia helpful or harmful? Yes, it is definitely helpful. It is not harmful. It is helpful. How? You know, in fever, as there is hyperemia in the cutaneous blood vessels, due to hyperemia, there is a radiation of temperature from the blood in the atmosphere, and there is decrease of temperature, so it is helpful. In acute inflammation, as there is vasodilatation, and following vasodilatation, there is increased flow of blood in the capillaries, and there are stasis of blood, and following stasis of blood in the capillaries, the cellular events of acute inflammation initiates, so it is helpful. Now come to congestion. What is congestion? Again we recapitulate. If this is the arteriole supplying a tissue and this is the venule that drains the blood. So this is the tissue. If arteriole is not dilated or not constricted, But if there is impairment of venous return, there will be accumulation of blood in tissue, and this accumulation of blood in the tissue due to impairment of venous return is known as congestion. Now come to definition of congestion. Increased volume of blood in affected tissue or in part of tissue due to impairment of venous return is known as congestion. So, increased volume of blood in affected tissue or in part of tissue due to impairment of venous return is known as congestion. Dear audience, in hyperemia there is arteriolar dilatation, so there is increased flow of blood. But in congestion, arteriole is unaffected, but there is impairment of venous return, so there is increased volume of blood in the tissue. So in both cases, there is increased volume of blood, but in case of hyperemia, the volume is due to increased flow of blood. But in case of congestion, the volume is not due to increased flow of blood, rather it is due to impairment of venous return. Now come to mechanism of congestion. Impairment of venous return increased volume of blood in capillary of tissue. So impairment of venous return, it will lead to increased volume of blood in the capillaries. So if there is impairment here, the capillary contains maximum blood. So following impairment of venous return, there will be increased volume of blood in the capillary of the tissue. Due to increased volume of blood in the capillary of the tissue, what will happen? There will be decreased arterial blood from the tissue. So due to increased volume of blood in capillary of tissue, there will be decreased arterial flow of blood in tissue. As there is decreased arterial flow of blood in the tissue, the blood within the tissue become deoxygenated. So there is deoxygenated blood in tissue, and due to deoxygenated blood in the tissue become bluish. And ultimately, there is chance of development of cyanosis. So, first impairment of venous return, increased volume of blood in the capillary of the tissue, decreased arterial flow of blood in the tissue, deoxygenated blood in the tissue become bluish, and ultimately chance of cyanosis. Dear audience, now come to causes of congestion. Congestive cardiac failure, CF. This is the right heart failure. Dear audience, if anybody suffers from CCF, that is congestive cardiac failure, there is chance of development of congestion throughout the body. So following congestive cardiac failure, entire body shows congestion. Another cause is impaired venous return from limbs. Example of impaired venous return from limbs associated with congestion. This is actually localized congestion. But if there is congestive cardiac failure, this is generalized congestion. So example of impaired venous return from limbs associated with localized congestion is congestion in lower limbs following long journey. Again, congestion in lower limbs following prolonged period of standing. Congestion of lower limbs following prolonged period of standing. Dear audience, again, if anybody suffers from congestive cardiac failure, entire body is congested. If anybody with long journey, there will be congestion of the lower limbs. That is localized congestion. And after prolonged period of standing, there is chance of congestion of the lower limbs, and it is also localized congestion. Dear audience, if anybody suffers from congestive cardiac failure, I have told you entire body may be congested. So there will be congestion of the lung, congestion of the liver, there will be congestion of the spleen. Now come to congestion in liver. If there is acute congestion in the liver, what will happen? In acute congestion of liver, there will be Meg Liver, there will be central hemorrhagic necrosis. In chronic congestion, what will happen? In chronic congestion, there will be cardiac cirrhosis. Dear audience, again, in congestion of liver, if it is acute congestion, there will be Meg Liver and central hemorrhagic necrosis. If it is chronic condition, there will be cardiac cirrhosis. Now come to Meg Liver in acute congestion. Meg Liver in acute congestion. Dear audience, if this is the hepatic lobule containing the central vein, and these are the hepatocytes radiating like the spokes of wheel. And again, this is the hepatic lobule with central vein, and this is the hepatic lobule with central vein. This is the portal tract. Dear audience, in Meg Liver, what happens? In Meg Liver, it occurs in acute congestion, there will be dilatation of the central vein due to increased volume of blood. What will happen? There will be dilatation central vein due to blood. And around this central vein, the zone of hepatic lobule become congested and pale. So dilatation of central vein due to blood, then around the central vein, the zone of hepatic lobule becomes pale and congested. And around this pale and congested zone, the rest of hepatic lobule is red and decongested. Around the pale zone, the rest zone of hepatic lobule is pink and decongested. This is not Meg Liver. Dear audience, again, due to congestion, the central vein become dilated. Around the central vein, the zone of hepatic lobule become congested and pale. Around this pale zone, the rest zone of hepatic lobule is normal. It is not congested. The color is pink, and it looks like nutmeg. It looks like nutmeg. Dear audience, if we cut a nutmeg fruit cross-sectionally, first in the central part we will see the endosperm of the seed, like the central vein. Around this endosperm of the seed, like the central vein, in the nutmeg there will be fleshy part that we eat, and it looks like the pale zone. And around this pale zone there is red zone. It looks like the bark of the fruit. If we compare it with a mango like this, and if we cut this mango, first we will see the endosperm of the seed. Around the seed we will get the fleshy part of the mango, and around this we will see the bark of the mango. So if we cut the nutmeg, it looks like this, so it is called nutmeg liver. Now come to central hemorrhagic necrosis. If liver is in acute congested state, there is chance of development of central hemorrhagic necrosis. It means necrosis of hepatocytes around the central vein along with hemorrhage. If this is the hepatic lobule, if the central vein, around the central vein, the hepatocytes undergo necrosis, and along with necrosis there is also hemorrhage, and this is called central hemorrhagic necrosis in liver in acute congestion. Now come to cardiac cirrhosis in chronic state. Cardiac cirrhosis in chronic congestion. If there is chronic congestion, the hepatocytes undergo necrosis, and following necrosis there will be fibrosis, and if there is fibrosis there will be alteration in architecture of the liver, there will be abnormal arteriovenous interconnections, there will be formations of regenerative nodule, and this is cirrhosis of liver. As this cirrhosis of liver is due to congestive cardiac failure, again as this congestion of this liver is due to congestive cardiac failure, and following congestive cardiac failure, as there is cirrhosis of liver, so it is called cardiac cirrhosis. Now come to congestion in lung following congestive cardiac failure. Congestion in lung. Dear audience, if there is acute congestion in lung, what will happen in acute congestion? There will be wet lung, there will be formation of heart failure cell. And if chronic congestion in lung, there will be formation of brown induration. First come to wet lung in acute congestion. What will happen here? Suppose this is the alveoli, this is the alveoli of lung, and this is the interalveolar septum. What will happen in wet lung? Increased volume of blood in capillaries of interalveolar septum. Due to congestion, there will be increased volume of blood in capillaries of interalveolar septum. Here, there will be increased volume of blood in the interalveolar septal capillaries. Due to increased volume of blood in the capillaries, leaking of fluid in alveoli. As there is leaking of fluid in alveoli, the alveoli is filled with fluid. Alveoli filled with fluid, and this is known as wet lung. Again, due to increased volume of blood in the interalveolar septal capillaries, there will be leaking of fluid in the alveolar lumen. There will be leaking of fluid in the alveoli, and the alveoli are filled with the fluid, and this is known as wet lung. Dear audience, now come to heart failure cell in acute congestion of lung. there will be increased volume of blood in interalveolar septal capillaries. Increased volume of blood in interalveolar septal capillaries. Suppose this is the alveoli, this is the another alveoli, this is another alveoli, and this is the interalveolar septum. Within this interalveolar septum there is capillaries, and the capillaries is filled with increased volume of blood. Due to increased volume of blood in the septal capillaries, rupture of capillaries. Rupture of capillaries. As there is rupture of capillaries, what will happen? Blood comes in alveoli. So, following rupture of capillaries, blood comes in alveoli. The RBC of the blood undergo hemolyzed or distraction of RBC in alveoli. As there is destructions of the RBC within the alveoli, what will happen? There will be release of iron from hemoglobin, and this iron is converted to hemosiderin. Conversion to hemosiderin, and this hemosiderin is engulfed by alveolar macrophages. Hemosiderin engulfed by alveolar macrophages. And this hemosiderin laden alveolar macrophage is known as heart failure cell. Hemosiderin laden macrophage of alveoli is known as heart failure cell. Dear audience, as there is congestive cardiac failure, that is, as there is right heart failure, following right heart failure, there is acute congestion in the lung, and due to acute congestion in the lung, there is formation of hemosiderin laden macrophage. As this hemosiderin laden macrophage is formed following heart failure, so this is known as heart failure cell. Dear audience, this heart failure cell is formed within the alveoli, and we can get it in sputum. Now come to, if there is chronic congestion in the lung, there will be brown induration. Dear audience, if there is chronic congestion in the lung, what will happen? There will be formation of hemosiderin, and this hemosiderin may be deposited in the interalveolar septum, and following deposition of hemosiderin in the interalveolar septum, there will be fibrosis. This fibrosis and the deposited hemosiderin in the interalveolar septum develops brown in duration. Again, if there is chronic congestion in the lung, following chronic congestion of the lung, the interalveolar septum undergo fibrosis. And within the fibrosis, there is deposition of hemosiderin. This fibrosis and hemosiderin within the interalveolar septum develops brown induration. Now come to congestion in spleen. If there is congestion in the spleen, there may be enlargement of spleen, or there is chance of development of siderofibrotic nodule. Siderofibrotic nodule. Dear audience, if congestion in the spleen may be enlarged due to congestion. Now come to what about the siderofibrotic nodule in congestion of liver. Dear audience, if there is chronic congestion in the spleen, there is chance of development of fibrosis within the spleen, and within the fibrosis there is deposition of hemosiderin, and this hemosiderin and fibrosis makes nodule. This is known as siderofibrotic nodule in spleen following chronic congestion. Again, if there is chronic congestion, there is chance of hemorrhage, and from the RBC there is release of iron. The iron is converted to hemosiderin, and due to chronic congestion there is chance of development of fibrosis. This fibrosis and hemosiderin makes siderofibrotic nodule in chronic congestion of spleen. Dear audience, this is all about the hyperemia and congestion. I have told you what is hyperemia: increased flow of blood in an affected part of tissue or in part of tissue due to arteriolar dilatation, and this dilatation is due to sympathetic neurogenic stimulation or due to action of vasoactive amines like histamine and serotonin. And in hyperemia there is redness of the tissue, and it is helpful for us. Hyperemia occurs in acute inflammation following exercise and in fever. Congestion, there is increased volume of blood in an affected part of tissue or in part of tissue due to impaired venous return. Here there is no change in the arteriole, rather there is impaired venous return. If there is congestive cardiac failure, there will be interbody congestion, or if there is impaired venous return in the lower limb following long journey or following long standing, there is chance of localized congestion in the lower limbs. If congestion in the liver following congestive cardiac failure, in acute stage there is chance of development of Meg liver. In the chronic form, there is development of cardiac cirrhosis. As the cirrhosis following cardiac disease, it is called cardiac cirrhosis. If congestion in the lung in acute stage, wet lung due to leaking of fluid and the filling of the alveoli with the fluid, there is heart failure cell development. It is the hemosiderin-laden macrophage of the alveoli. In the chronic form, there is development of brown induration, and congestion in spleen is associated with this enlargement and siderofibrotic nodule. So this is all about the hyperemia and congestion. To wrap this, thanks all.